Hospitalist faculty, Dr. Christopher MOTYL and Dr. Logan Murray, for exploring more about this evolving new business in Maine, the cannabis business, and how that is leading to accidental pediatric exposures and intentional use among our older patients, and how to diagnose and manage cannabis-related health problems in terms of complications and toxicity. So it looks like Logan is going to get us started.
Great, thanks, Mary. So our disclosures are no conflicts of interest, and we're not going to discuss any unapproved products or off-label uses. The CME code is 59113, and we'll put that on again at the end in case anybody misses it on this slide. So what are our objectives today? We want to review how we got where we are, the timeline for medical and recreational cannabis in Maine, and we want to get an understanding of the current regulatory status. There are some subtle complexities between medical use and adult recreational use that are good to know and that help inform any policy recommendations that we make. And then because these the proliferation of cannabis and the availability of cannabis can lead to particular patterns of medical concern, depending on age, we want to look at how to recognize and how to treat cannabis intoxication in young children, generally under 6, and the issue of some of the complexity that comes for the older children, and teens, who are heavy users. So there is a sort of biphasic pattern in terms of where cannabis intersects with the medical system. We want to look at particular products that pose special risk of ingestion for children, edibles and their attractive packages. And we're going to review potential advocacy opportunities within this realm as our to-dos from today's presentation. So I'm going to hand it over to Chris.
So I thought it would be important to kind of talk about the historical timeline for kind of how we got here in the state of Maine. And kind of, I think it'll also shed a little bit of light into some of the things we're going to talk about later. And so initially Maine banned marijuana completely in 1913, actually criminalized it. And it wasn't until a voter initiative in 1999 that medical marijuana was actually approved. It was actually a 62% vote. And it authorized the use of medical marijuana for qualifying medical conditions. But the law that was passed didn't really address access or distribution or any conflicts with the federal law. So it really, nothing really happened with it until 2009, when another voter initiative started. And that was in November of 2009, the vote was for an act to establish the Maine Medical Marijuana Act. And that was actually pretty well supported within the state, with 59% of the vote in favor. And so at that time, Governor Baldacci issued an executive order to establish a committee to kind of figure out how to implement the medical marijuana within the state. And it took them a while to figure that out. It wasn't until 2011 that the first medical dispensary actually opened in Maine in March of 2011, and Portland opened its first dispensary in March of 2012. And then fast forward, there's a lot of other states that are starting to legalize recreational use. And so this was put on again as a voter initiative ballot. And there was, in November of 2016, Maine voted on an act to legalize marijuana, and it passed, and it was considerably narrow. The vote was 50.26% in favor, with only a difference of 3,995 votes. And it actually ended up going back for a recount before being certified that this was actually the vote from Maine. And then things started to loosen up in terms of the restrictions for medical providers in 2018. Before, they had to have specific medical conditions that they were certifying patients for medical use. And then in 2018, in February, it changed. And so medical providers then could certify for any condition that they felt would benefit from potentially the use of medical marijuana. So then it did take some time, though, for Maine to kind of get to where they could implement and actually legalize adult use. And part of that problem was that it took 2 legislative rewrites, and actually Governor LePage at the time vetoed the law, and they actually had to override the governor's veto. So it wasn't really until after he left office in the inauguration of Janet Mills in 2019, a month after her inauguration, she implemented the Office of Marijuana Policy. And really what they did is they worked with a consulting company, Cannabis Public Policy Consulting, to provide consulting services related to marijuana rulemaking for the state. And it wasn't until a year later in 2020 that the first adult use recreational retail licenses were awarded. And it's important to note here that that individual towns actually still can control whether or not they allow retail sales or other kind of aspects of the marijuana industry to be part of their town. And so municipalities can vote to be a dry town or not. So for example, the town I live in Scarborough has voted no on any retail stores within Scarborough. And it's really up to each individual municipality. And then in 2021, this past year in January, there are actually some updated medical marijuana rules that were released from the Office of Marijuana Policy, and they've been pretty met with a lot of resistance from the medical marijuana community. And there's some specific things that they are concerned about. So you can find more information about that. It's been pretty well covered in the Press Herald. And then the other aspect of this in the future of things that are going to come down the line is that Maine legislature is going to consider marijuana social clubs in 2023. So I think it's important to kind of understand kind of the differences between medical marijuana and adult use marijuana. And so I'd like to cover a little bit of kind of the information about each one. So for the medical marijuana, there's actually no age requirement to be certified and approved to use it. Any minors, so anyone less than age 18 for using medical marijuana, but it isn't, it's something that is to be considered. It is required that you have a medical marijuana card. And currently in the state, we have what's listed as 8 dispensaries, and there's really one per a DHHS public health district. They're nonprofit entities until recently. And when I go to the Office of Marijuana Policy's website, there's actually only 7 listed there, but they say that there's 8. And one of the unique things about the dispensaries is that they're allowed to grow an unlimited number of plants. There's also within the medical marijuana community, there's registered caregivers. And the Office of Marijuana Policy keeps data on this. And currently in the state, there's 3,084 registered caregivers. And a caregiver can be just an individual who is identified and has a license to be a caregiver. And it might be to just to one patient or a couple of patients. Or it could be potentially someone who has a storefront and is where you would potentially go if you have your medical card to purchase medical marijuana. And these caregivers, they're allowed to sell you with your medical card up to 2.5 ounces of prepared marijuana product. And if you're visiting from even out of state, you can use your medical card. There's a list of approved states that if you have a medical card from that state, that you can actually purchase marijuana. They limit your purchases to 1 every 15 days if you're from out of state. And then you can also, the caregivers can possess all of the cannabis that their medical plants produce. So this is important to know. So the caregiver will purchase a license from the state, and depending on the type of license they have, determines how many plants that they can actually grow and maintain. But they're able to keep or use all the cannabis that's produced from those plants that they have a license for. And patients themselves can actually own 6 mature plants, 12 immature, and unlimited seedlings. And when you go and you purchase medical marijuana, it's taxed at the state tax rate, so 5.5%, but there is an 8% tax rate on edibles. Now, when we transition to the adult use program, this has a lot more. This is very limited to only adults, so it's 21 and older. You don't need to have a card, and currently, right now, from the data at the Office of Marijuana Policy, there's 25 active licenses that have been awarded within the state to date so far. But this is going to increase. So what that means is there's going to be more stores and more storefronts available for people to go and purchase adult use products at. Right now, there's 26 conditional licenses that they're reporting that have already gotten jurisdiction approval, and there's 155 conditional licenses that are in their first step, and they're waiting to get jurisdiction approval. And again, just like at the medical dispensaries, adults can purchase 25 ounces of product and no more than 5 grams of marijuana concentrate. And what that means is really 5,000 milligrams of THC. Mainers can also grow marijuana for personal use. You can have up to 3 plants, mature plants or 12 immature and unlimited seedlings. And you can even give those away, mature plants. They have to be to an adult who's older than 21 and completely free of charge. But there's a significantly higher tax rate for adult use sale of adult use products. It's 10%. And one of the things to note is that adult use and medical use marijuana may not be dispensed from the same facility. So you have to have different storefronts with different licenses to be either considered a medical marijuana store or an adult use store. So one of the things I wanted to look into was kind of, well, what's the trend in Maine? How is this industry potentially growing? And I specifically wanted to first look at medical marijuana. And what I wanted to show here is this is showing you the number of printed patient certificates. So this is printed medical cards. And you can see that it steadily had an increase over the past 5 years to a high of 96,046 printed medical cards. Now, I want you to take this with a grain of salt because this could be, there could be people that needed to have a reprint of a card because of a lost card or a destroyed card. It might need to be reprinted because of potentially somebody having an error on the card that was printed for them. But the other piece that I was able to find out is that currently right now in 2020, there was 382 printed certificates for minors. And we've also seen a growth in the number of medical providers that are providing the certificates to patients. You can see in 2020, there were 714 medical providers. So these medical providers need to have a Maine license, and they either need to be an osteopathic or allopathic physician or nurse practitioner is who can prescribe within the state of Maine. So one of the things I also wanted to look at is how big is the marijuana industry right now in Maine. And we actually really didn't have a good sense of that until 2019. That's when the Office of Marijuana Policy first started collecting data on kind of how big the industry was, specifically around the sale of medical marijuana, because we just started the sale of recreational use marijuana sales in the state this past year. So to give you an idea of where this is in terms of the agricultural and fishery industries within Maine, Maine lobster, of course, is king. It generated in 2019, $485 million. Potatoes in 2019 were second with 167 million. So in the first year that they started collecting information about the sales of medical marijuana within the state, they were actually surprised with how much money the industry, how much money there was in the sales. They had anticipated it being around $50 to $60 million. And what they were surprised to find is that it was actually closer to 112 million. And this number skyrocketed in 2020 and doubled to $266 million in sales in 2020. So what about adult use? So adult use is also significantly increasing. And like I had shown you that slide before, right now there's only 25 retail stores within the state. But to date, which start with the adult use starting in October, they've already had $13 million in sales. And the slide next to it kind of breaks down what's being sold, what products. And so you can see here the majority of that being usable marijuana. Infused products would be like edibles, and then concentrates would be things that are like marijuana oils or resin or waxes, and then things that would be potentially like bought and used in a vape cartridge. So you can see that that's also increasing in sales. And to give you an idea of how many sales they're doing in a month, this is the sale data from March of 2021. So there were 49,649 transactions with generating $3,751,000, which if you break that down and you divide that out, it's about $75 per sale. And that generated just in the month of March, $375,000 in tax revenue to the state. So as this industry is growing, there's some researchers, there's one researcher in particular that I am quoting here, who's done a lot of research in Colorado, and their adult use and medical use programs are much further developed and kind of farther along than what we are. But I think this is very an applicable quote. So one of the unintended consequences of marijuana legalization is the impact on pediatric population, from prenatal exposure to unintentional childhood exposures to concerns of adolescent abuse. Marijuana potentially affects pediatric patients at every stage in childhood. And so I thought it'd be important to kind of look at kind of with all of this increasing availability and use among adults and medical patients, how is that impacting our youth, and specifically around like their attitudes toward it and kind of what their usage rates are. And there's a really good study called the Monitoring for the Future study that's been ongoing that specifically looks at drug and alcohol use and related attitudes among adolescents nationwide. And they also look at kind of emerging trends within adolescents across the country. And they really try to assess lifetime use, past year use, and past month use. And the study originally started in 1975 with 12th graders, but it wasn't until 1991 that they added 8th and 10th graders. And the most recent data they had included 11,800 students, and it was over 112 public and private universities. And the study's done out of the University of Michigan. And kind of some of the key things that they found is that within the past year, overall, the past year use rates among 8th, 10th, and 12th graders has remained about the same. You can see here that it might have gone down a little bit, but in general, 12th graders, the past year use rates nationally is 35%, 10th graders is 28%, and 8th graders is 11%. And then they also look at daily use. So daily use was also kind of pretty consistent, but also kind of surprising if you see this. There's 12th graders, about 7% across the nation are using marijuana regularly on a daily basis. And one of the things they also like to track is trends. So you can see here, vaping has become increasingly more popular among adolescents, and that's well supported, but also vaping marijuana has become more prevalent. And you can see that in the past year, there's an increase of students that have been at least once tried marijuana vaping. They do look at also daily use, and there was between 2019 and 2020, there was a decrease in amongst 10th graders and 12th graders. So that's a small decrease, but it could be significant. So what about Maine? What kind of data do we have about use in Maine? Well, there's actually something called the Maine Integrated Youth Survey, and it's a direct survey that looks at health-related behaviors and attitudes of 5th graders through 12th graders. So it goes to a much younger age, and it's a collaboration between the Maine DHHS and Maine DOE, and it started in 2009. It's done every 2 years. So the most recent data is from 2019. Unfortunately, they don't have their methodology of kind of how many schools were involved and participated in the study. And they're actually, it says on the website, 2017, 2019 methodology reports are coming soon. So when I looked at the 2015, just to give you a sense of how many schools participated across the state, it was 353, and they had schools represented from all 16 counties within the state. But there's a summary of kind of their findings, and I have a couple of their graphics, and then I have actually the data, which we're going to go through and look at a couple of the questions. So among middle schoolers within Maine, 38% of them believe there's little or no risk, and this is for middle school students, and this is for people that use marijuana once or twice a week. They found that 18% of middle school students have tried at least marijuana once before the age of 11. And that it was 1 in 10 students have ever tried it. And I thought that was kind of surprising. And then 1 in 20 students, or 4%, have used it at least once in the last 30 days. And they even looked at 5th and 6th graders to see what are the rates of patients that have tried it, and that actually had doubled from 2017 to 2019. You can see that it's at 1.8%. So when we move on to the high school students, the rates are 36% have ever tried marijuana, and there's really no difference between males or females. And that 22% of students have used marijuana in the last 30 days, 53% have said it's easy to get marijuana, and 60% have at least one friend that have used in the last year. And the perception of harm is also decreasing. And we're also seeing that what patients, how patients feel, or how students feel their parents would feel about them using. So what I wanted to look at is some of the actual questions that they asked. So here is the last time you used an electronic vaping product, what was in the vapor that you inhaled? And this is specifically looking at the percentage of students who answered marijuana or hash oil. And what's clear is that most students are vaping nicotine, but still around 10 to 15% of 9th to 12th graders are using, at least the last time they used was actually a marijuana product that they were vaping. And then looking at this here, during your lifetime, how many times have you used marijuana? The percentage of students answering at least once, 50% of Maine students are trying marijuana by the end of high school, by 12th grade. And then how old are they when they're trying this? Well, this is showing you here that more and more students are trying marijuana at a younger age. You can see that of the 12th graders, it's around 5%, but that 9th graders, that is significantly increased. So students are starting to try marijuana at a younger age. And then looking at during the past 30 days, how many times did you use marijuana? And so this is in the last 30 days. 12% of 9th graders have used marijuana in the last 30 days. And then among students who have used in the past 30 days, what students how are they using it? And specifically, are students using it in another way other than smoking it from a joint, bong, pipe, or blunt? So this is telling me that 70% of students, when they're using marijuana in the last 30 days, are typically smoking it, but about 30% are choosing to use a different form. So that would be potentially somebody using it as an edible, or somebody who's vaping the product. And if you wanted to get marijuana, how easy would it be to get? How easy would it be to get? And it's pretty clear that as 9th graders progress to 12th graders, the percentage of students answering sort of easy to very easy are significantly increasing. You can see here that by 12th grade, 65% of students think it's very easy or sort of easy to get. And then this is a question about perception of how wrong do you think your parents would feel about you using marijuana. And which was interesting is that by 12th grade, 26% of students think their parents won't mind if they use marijuana, or they would be they think it would be a little bit wrong. And then the perception of risk. So this is for students. If they, what's the risk if I use marijuana regularly? If I'm using it one time or twice a week? And really, you can see here by grade 12, 72% of students don't see that there's really much risk at all with regular use 1 to 2 times a week. And this is a topic that's a little dear to my heart because I did a grand rounds about 8 years ago on it. So I wanted to look at what about during your lifetime, have you ever used synthetic marijuana? And what's I guess a good thing is that the majority of students, it looks like, have not tried using synthetic marijuana. It looks like it's pretty consistent among grades 9 through 12. So most students are not using it, and they're using a non-synthetic product. So what I wanted to know then is if we have, more increasing use among our adolescents, and we have decreased perceptions of harm, what about the students that are potentially getting themselves into trouble and then ending up, potentially seeking out care, calling the Poison Center for various variety of reasons? And so I reached out to the New England Poison Center, Northern New England Poison Center. I talked with Dr. Karen Simone, and I was able to get some of her data. And this year is showing you over time all exposures. So this is for all ages and all exposures. And it could be the top line is any case involving marijuana, whereas the blue line is involving marijuana alone. And you can see that the rates of calls that the Poison Center is getting is increasing steadily up until 2019. And we saw a slight drop in 2020. But what I wanted to know is, of those calls, how many of them are kids, and kind of where do they break down at? So this here is the data looking over the last 4 years for patients ages 6 to 12, and the number of calls that they got for patients that are in that age group. And you can see the total here, kind of follows that trend that we see this jump in cases in 2019. And they also start to see and they track cases that are related to abuse. And you start to see some of these 6 to 12-year-olds are coming in. And the reason why is because of abuse. The Poison Center is getting called. So then what about teenagers? Well, we can see that this also starts to increase within that abuse category. And these are the numbers for the last 4 years. And they kind of have different categories. So the first category would be abuse, which would be someone trying to get high and use marijuana for that purpose. You can see the numbers here. In terms of adverse reactions would be someone who is, using a vape pen and develops coughing and shortness of breath. So it was a, reaction to that, or someone who may have, smoked marijuana and then got dizzy, lightheaded, and passed out. And then were brought to the ER for that. So these would be categorized as an adverse reaction. And then the general unintentional, this would be someone who maybe accidentally took an edible that didn't realize it was. So it could be like they found some brownies in the fridge and they thought that they were an edible, like a brownie that their mom or dad had made or somebody had made in the house, and then they ingested it. So that would be what be considered a general unintentional. And these are specific to just involving marijuana alone. But a lot of teenagers are also are using marijuana in combination with other things. So this data here includes the marijuana alone cases, but also cases where they might be using something else. So when I talked with Dr. Simone, she was saying, in particularly with some of these abuse and suicide attempts, they're seeing co-ingestions with alcohol, with ecstasy, with dextromethorphan. And so you can see that, the numbers are significantly increasing. And when you look at it in this aspect of combination with other products and substances. And then, so just to kind of break down the other categories. So intentional misuse, this is a little bit of a challenging category to categorize. Not in terms of marijuana, but what this would be considered would be if somebody is, let's say, using caffeine to stay up late and they end up taking extra caffeine and then they present with palpitations, or somebody who's spraying weed killer in their garden and they like over spray their weed killer and then get toxicity from that. Adverse reactions, we kind of talked about those earlier. So you can see here that data. So, but I think probably what we're mostly seeing on the pediatric hospital medicine side of things is we're definitely seeing exposures among young kids, so the 0 to 5. And this is data from 2011. And again, you can see that there's a significant increase starting in 2016 with a peak in 2019 of exposures involving very young patients ages 0 to 5. So what I wanted to know is what happens to these patients? Like, what's the disposition of them when they are when the Poison Center gets a call? So you can see here that when they looked at the data from 2016 to 2020, that included a total of 86 patients. And 20 of those patients were able to be managed at home. 12 of those patients had to be admitted to an ICU. 13 of those patients had to be admitted to a non-ICU, like the floor at Barbara Bush. 33 were sent to the ER and then released, and 8 of them, the patients or their parents refused the referral. But if you look at that 12 patients admitted to the ICU and 13 admitted to the non-ICU, that represents about 30% of these patients being admitted that are ages 0 to 5 admitted to the hospital for exposure involving marijuana. And almost all of these are involving edibles. So what I'd like to do now is have Dr. Logan Murray talk to you about some of the cases that we've encountered this past few years.
So as Chris's data shows, this is really becoming a bigger part of what we do as pediatricians, and the hospital medicine service is no exception. So the first case is SB. She's a 2-year-old female, and the initial presentation at a referring hospital was she hit her head. She was petting the dog under the table. She stood up quickly. She hit her head. She didn't lose consciousness. She didn't vomit, but they worried about her, and so they brought her into to the referring hospital. And in their history, they say, yeah, well, 30 minutes later, she was eating pizza, milk, grapes, and with good appetite, and she started acting silly. So the question was, why silly? You know, when you hit your head, you don't usually start acting silly. But then an hour and 3/4 after the initial event, she started walking unsteadily, and she was answering all the questions with no, and she was looking like she was drunk. So this sort of presentation of, we think we've got a concussion, but she's got a great appetite, she's acting silly, and then she's drunk. So we end up with her coming to Maine General, and they obtained a urine tox screen and transferred her to us. And the urine tox screen came back during her transport here. So when I saw her in RED, she was difficult to arouse with verbal commands. So definitely a depressed GCS. Her pupils were dilated but reactive, and her lower extremity reflexes were fine, no ankylosing. And then the UTOX comes back positive with THC, and I still remember the father saying, "Oh yeah, that's right, the cookies arrived." And it was as if he was disassociating himself from them. He never said who brought them. It was almost as if these cookies had just walked into the room where the kid was. We admitted her, we watched her, monitored her, and after 36 hours, her mental status was back at baseline. She didn't end up with respiratory depression or need an ICU. But these ingestions, what can we learn about them? The mean age for these is about 2 years of age. And this is a systematic review of 114 cases. And some of these cases were more than 10 years ago, and some of them are quite recent. This was published in 2017. In this study, 38% of them were cannabis resin, and the edibles were only 13%. But the newer cases were edibles, and that's what we're seeing in our patients on our service. There were some other exposures. Passive smoke was included. There must have been a really intense bake in that room that the kid was, but medical cannabis, of course, candies, beverages, and hemp oil. Most common presenting signs, and our patient had these both, was lethargy and ataxia, and she had both of them. Interestingly enough, there was also reports of tachycardia, hypotonia, mydriasis, and pupils are fascinating. They can be dilated, midpoint, or pinpoint. And so the pupils are not as reliable a clue to the toxidrome in this case as they would be, for example, in benzodiazepine ingestions where everybody is dilated. Length of stay was 27 hours, very similar to our patient. But nearly 20% of them went to the PICU and 6% of them were intubated. So the respiratory depression definitely is a factor for some patients. I think the other thing that we always want to be cognizant of when we're taking care of these patients is co-ingestions. If a kid can get into pot cookies, maybe they can get into the aspirin or the acetaminophen that's lying around as well. So a good idea not only to do the tox screen, but also to check acetaminophen and aspirin levels in these patients. It's an international problem. This is a very recent paper from France, and they're seeing cannabis resin there as a major part of the ingestions, and similar percentages in terms of respiratory depression and intensive care. Thankfully, no fatal cases. So we have a database on the hospital medicine service that's very valuable to look back through and say, who are the patients whom we've taken care of, their diagnoses, and we can get some details from that. So on our service from 2018 to 2020, 3 years, we had 11 cases on our service. Age range was 9 months to 6 years, and here are the sources. Cookies was the #1, including SB, our case. Candies, fruit bar, gummies, a CBD pill, parents vaping, so there was one exposure from parental use, a Rice Krispie square with marijuana butter, and one unknown where the parents just couldn't identify how the kid could have gotten into the cannabis. So edibles, as we're seeing, the big trend is edibles are becoming a bigger part of the exposure for these under 6-year-olds. I'm going to transition now to case 2. This was a 16-year-old. So I told you, we mentioned the biphasic issue, and Chris was dividing up his data by under 5, 6 to 12, and then over 13. So our next 2 cases, cases 2 and 3, are going to be in that teen, that 13 and up group. AB was 16 years old. AB had 3 admissions for pericarditis about a month apart. And on the second admission, pericardiocentesis produced half a liter of fluid, more than half a liter of fluid around his heart. So pretty intense pericarditis. On the third admission, he had pericardial thickening without fluid collection, consistent with pericarditis without effusion. And this is can be a bad prognostic sign, I'm told by the cardiologist, for a restrictive pericarditis, a more long provide some additional help, and got the PAC team involved, and they were extremely helpful on that. So a shout out to Alison Caldwell and her team for their good assistance on this complex case. He smokes a heavy amount of marijuana, and he self-treats depression and anxiety 3 times a day for a substantial period of time. And so difficult to conclusively prove the causality, but he had no other risk factors for pericarditis at all. And so we think that this was a case of cannabis-related pericarditis. Elevation, the classic ST elevation of pericarditis. They looked at this question of pericarditis in adolescents and young adults in Colorado, and have 3 cases of young men, all of them with substernal chest pain, all of them with the EKG changes and elevated troponins. And the age range of this group was 19 to 23. Again, like our patient, none of them had significant risk factors other than heavy cannabis consumption. They were admitted, their troponins were trended, and they had low positive troponins, as did our patient. They all left the hospital with a diagnosis of myopericarditis. So what's the takeaway from this? And the other thing is that it is a substantial increased risk factor for myocardial infarction in a patient who would not be a typical age for an MI. So heavy cannabis use also associated with MIs. The conclusion is that if you present to the ED and you're a teen or a young adult with chest pain, even though your age is incredibly untypical for an MI, you should have an EKG and troponins and more formal evaluations if there's a history of recent and/or chronic cannabinoid use. So it changes our algorithm for chest pain in the adolescent and the young adult. Our third case is KG, and KG is notable for frequency of their visits to our healthcare system. Over 12 months, I counted in Epic, from April of 20 to the end of last month, 27 ED visits and 5 inpatient admissions for intractable nausea and vomiting. And so on average, this patient goes to the ED 5 times before they're admitted. The range is that they've been to the ED 7 times before admission and on the most ED visits, and 3 times was the quickest that they got admitted. So they'll go daily to the ED and eventually become admitted. This patient smokes cannabis on a daily basis to self-treat anxiety. Over the course of this past year, the patient has had multiple KUBs, a CT of abdomen and pelvis, ultrasounds, EGD, colonoscopy, and a nuclear medicine gastric emptying scan. And the only thing that's ever come up positive on this patient is that her gastric emptying is at the 4-hour level slowed with a 77% and normal 90%. So in diagnosing the cannabinoid hyperemesis syndrome, what you'll see is a pattern of cyclic vomiting and heavy cannabinoid use. So this patient has classic prodromal symptoms of nausea. Initially, in the early stages, can tolerate clear liquids, and that's why home until they're dehydrated. Ondansetron does not work. Classically, hot showers can help, but they don't consistently for this patient. And for this patient, droperidol and capsaicin cream to the abdomen are the most effective. They do have some comorbid psychiatric diagnoses, and they're followed by a child psychiatrist in our community who has worked extensively with this patient. And every provider has consistently counseled to discontinue marijuana use. That's a consistent message that has gone across from psychiatry, from GI, and from all of the hospital medicine visits. If you want to look at cannabinoid hyperemesis, what are the common characteristics? History of regular cannabis for any duration of time, 100%. Cyclic nausea and vomiting, 100%. Resolution of symptoms after stopping cannabis, 96.8%. And this patient off cannabis in the hospital, symptoms remit. Compulsive hot baths with symptom relief, not as effective for this patient, but for a lot of people they are. Male predominance, abdominal pain. This patient has been variously diagnosed with functional abdominal pain, and some of the workups have been related to trying to find a source. And at least weekly cannabis use in this patient's cannabis use is typically daily and multiple times per day. So the treatment for cannabinoid hyperemesis, and again, cannabinoid hyperemesis is not fully understood. The evidence for its exact mechanism is still unknown. But cessation of cannabis works. 30 out of 31 patients in one case series, they had resolution of symptoms. Dopamine antagonists like haloperidol and droperidol appear to work, and it's thought because the symptoms may be coming from delta-9 THC, increasing dopamine synthesis and dopamine cell-firing. So when the antagonists turn it down, that's a helpful treatment. And the topical capsaicin cream has one receptor. Capsaicin has only one receptor, TRVP1, and that's thought to interact with the endocannabinoid system. So that's at least the theory on why capsaicin cream works. And the capsaicin cream is applied to the abdomen. One key thing, these are people that come in with abdominal pain. They're often very uncomfortable, and so there's a tendency to give them opioids, but the wrong decision on a couple of fronts. Number one, the way that it can slow gastric emptying and worsen constipation if that's part of their picture, but also opioid dependence in a person who's already shown that they have a tendency toward substance misuse. So avoiding opioids and targeting what we know about the mechanism for cannabinoid hyperemesis. So I'm going to turn it back over to Chris to talk about next steps. What can we do given the information that we now have to reduce harms?
So one of the things I think that's important to think about is, as pediatricians, what things can we do to advocate for the safety of our young patients and our adolescents? And then also, what kind of things can we talk to families about, and how can we do a great job with taking care of these patients and their families. And I think one of the things that's going to be really key is that, based on where things are in the state of Maine and the legislature, it's going to be really important that we work together with the medical and the adult use communities to try to really work on actions that we think will be helpful and protect our patients. And it's not us against them or anything like that. We need to work together. And so some of the things that we can potentially look at, and the state's already implemented some of these things, is child-resistant packaging. That really is helpful with preventing some of these unintentional ingestions. Other things that can be helpful that have been done in other states is dosing limitations. So this is the dosing, the total amount of THC that might be contained in the total package. So for example, you might be able to limit the total dose of an edible, like a chocolate bar, to 100 milligrams, and then no more than 10 milligrams per THC serving. Obviously, no mass marketing campaigns or advertising directed towards children. Having products placed in opaque packages so they can't actually see that there's gummies within the package or that there's a candy bar within the package. And then mandating label warnings to keep out of the reach of children. Specifically looking at rulemaking on making marijuana products with recognizable universal symbols. And then looking at school and public education campaigns, and specifically talking to families, asking parents about marijuana in the house, and then educating them about how to store it safely. So I want to take the time to specifically look at a few things. And that first thing is really packaging, because this, we saw kind of the data with the number of patients being admitted from unintentional ingestions in the state in that 0 to 5 range. And really this can have a significant impact, I think, on that population. And the reason for that is these edibles are sometimes manufactured and marketed in a way that they look exactly like products that our kids love to eat. So you can see here, there's just an example of some products. And when you talk with the Poison Center, the main things that in terms of edibles that they've been having a problem with are definitely gummies, actually something called nerd ropes, and then other things like baked goods like brownies and cookies. And so here you can see an example of Sour Patch Kids, and then this is a packaging of edible gummies that have a 350 milligram amount of THC within that package, or gummy bears here that have 300 milligrams of THC. These nerd ropes, they look identical to the real product. And that's 400 milligrams per rope. And then here's an example of a brownie. So on the left here is a whoopie pie that you can purchase at Whole Foods. And look how similar it looks here to an edible brownie that contains 500 milligrams of THC. So what are the requirements in Maine in terms of packaging and labeling? So right now, Maine requires that both adult use and medical use products be packaged in child-resistant packaging, or that they're placed in child-resistant packaging at the point of final sale. And that packaging is supposed to be opaque. If there's a liquid, it's supposed to have a child-resistant cap. In terms of the labeling, it should have the THC potency, which is really the amount of THC, like the percent of THC within that product. And then if it's an edible, it should have the amount of THC in the actual edible itself or per serving. There is some requirements around a universal symbol for adult use, but for medical use, it just needs to have a signifier that it contains marijuana. And they're also supposed to have nutritional information. Both adult and medical use packaging requirements are specific that they may not be labeled or packaged in a manner that's designed to particularly appeal to a person under the age of 21, and they may not be sold using labeling or packaging that depicts human, animal, or fruit. So these are the symbols that are required. So you can see here that this one here on the left, it says contains THC. This is required on all adult use products. It's only encouraged though for medical use. And then the symbol on the right, the not safe for kids, is an optional symbol. It's not required by state law. So with the increase in both adult and recreational use marijuana sales, there's actually another industry that's also been growing, and that is the industry around child-resistant packaging. And this here is examples of different packaging options that are child-resistant. And I wanted to draw your attention to the bottom two on the right. So the first one is a pinch and slide, which is basically a special Ziploc bag that once you place your product in and seal it up, it's not easy to open and grab from the top of it and open. You actually have to pinch where the little finger mark is and slide your finger. And then what happens is it gaps and opens where it's sealed, and then you can run your finger down it and open it. So it's much more difficult for a toddler to open. And then there's also these other bags that have, you can see here, where they open at, the zipper part that opens actually clicks into place and is secured, and it takes a lot more finesse and skill and dexterity to open, and so it's much more difficult for a child to do that. But I wanted to show you kind of how effective this packaging can be. And I'm going to show you a quick video. So the other thing is that
Never hold a sneeze in by blocking your nose and mouth with a hand. Sneezes travel at a speed of 200 miles per hour. Now, can you imagine the consequences of preventing this turbo gust of air from getting free?
Sorry about that. Just trying to share this. Share screen. Wouldn't be a presentation without a few technical difficulties. So finally, some other kind of public health and safety measures. So the Office of Marijuana Policy recently released notification that they're seeking potential companies or bidders that could help them implement their marijuana public health and safety campaign. They're specifically looking at initiatives and campaigns focused on increasing the awareness and education of public on health and safety matters related to the use of marijuana and marijuana products. And they also want to look at helping partner with the Office of Marijuana Policy specifically to look at, but not limited to, preventing and deterring the use of marijuana and marijuana products by people under the age of 21. So,
So kind of concluding things that we're saying as we look at the whole picture and things that we can do as a pediatric community. We've got a problem. Medical and adult use marijuana increases the quantity of cannabis products available in Maine, and that can pose an increased risk to children. So we're not taking a position on any of that in terms of the pros and cons of policy. We're just saying, as those who are charged with protecting children, what can we do to reduce risk? So there's young children that are at increased risk for accidental ingestion. Older children and teens are at risk when they have regular and frequent use, as we saw with the pericarditis and with the cannabinoid hyperemesis. Those are two of the things that can occur. Also, co-ingestion with other substances and suicide attempts is definitely something that we have seen. We've got a perception of harm decreasing among students, and access is perceived to be increasing. So at every level of the healthcare system, from the medical home to the ED to the hospital, we should be asking caregivers about marijuana in the home and educating them on how to protect their children depending on age and access and the answers that they give us. So we have a role to play, and I think we can partner with the government, with the state, and with others in making Maine a safer place for kids in terms of their access to cannabis. So at this point, there's our CME code 59113, and we're open for any and all questions. I know there are questions on the chat and the Q&A, and I believe Amy Bukowski is going to share some of those with us.
Yes, I'm going to draw everyone's attention to a couple of comments from Erica Schumacher and the Northern New England Poison Center, but I'm going to focus on the questions for this portion. So one question is, in the patient KG, were you able to stop cannabis exposure and use when she was in the hospital, at least temporarily?
In the case, I think so. I mean, we can never be certain that the adolescents aren't smuggling things in, but at least the case that of KG, we saw no evidence that was occurring. We're very supportive caregivers. I don't think they smuggled anything in, and COVID made that a little bit more manageable, I think, because there were limited caregivers that were allowed to be here. And so KG's symptoms remitted during hospitalization. There was never any evidence that smuggling was happening.
And the next question is, who's responsible for testing and confirming that the products that you showed Chris actually contain those amounts of THC?
Yeah, so that's a good question. So part of that is put in for within the legislature. So to be able to sell a product within the state, you have to have it tested, and it has to test for potency. It also is tested for having other kind of contaminants or mold within it, and also specific pesticides. So products that are sold either as a medical product, medical use product, or adult use product have to be tested. And then there's actually testing that's part of the industry. So within the state and out of the state, there's labs that will test these products specifically for those things, so that they can then certify that their product doesn't contain those harmful, chemicals or harmful molds, and then what the actual potency level is of the product.
Do you all know if there's any legislation pending to address any of these concerns?
Amy, can you repeat that one more time, please?
Do you know if there's any legislation pending in Maine that address some of these concerns? Any like marijuana legislation this session?
Well, the biggest one that has been in the news recently has been related to some of the new rules that have been proposed for the medical use. They want to try to bring it more in line with adult use. And there's some things that specifically have been cited within the news that a lot of the caregivers aren't in support of, partly because of, so one of them is implementing surveillance systems. Another one is also tracking products. So from whoever's growing it to then when it ends up at the lab, and then tracking it back to the store, and kind of keeping more of a controlled monitoring of that inventory. So there's a few things in the legislature that I've seen, and then the other piece is the campaign that they're having for public health. But I'm not aware of any other legislature that's within the state. So I'm not sure of anything else though.
I'll just add, there was a follow-up question about how about AAP involvement. I think the AAP has been much more heavily putting their weight behind ending flavors in tobacco products this session, rather than focusing on a specific marijuana bill, as far as I know. The next question is, are there any data on how many and which practices are handing out med cards, especially to pediatric patients?
I wasn't able to find that information. I worked, so some of the information is open access that's on the Office of Marijuana Policy's website. The other thing is that I worked with the Northern New England Poison Center to get some of the information about minors. And the only information we could get was the total number of printed cards. They actually don't even break it down by what ages those patients are. I'm not sure if they would have that information as to like what providers are is it only a handful of providers? But again, that are writing them for minors. But I think that one slide that I showed earlier talked about and showed the number of providers that are writing for cards has significantly improved. And I think that slide showed that it was in the hundreds of providers, 600-700 providers. And kind of I talked about who can potentially be a provider, and that's a Maine licensed physician or nurse practitioner.
I see Dr. Schumacher's comment there about this as a public health crisis. So yeah, thank you for your input there. I think you're right that there's some definite abuse in terms of the medical cards, and clearly clearly there's work to do in that arena from an advocacy point of view.
Right. And again, I want to stress that. So in 2018, the law did change. So you used to have a specific condition that you were using to treat with a medical use card. Now a physician can prescribe medical marijuana if they think there would be any benefit to the patient's care. There's not a specific condition that it potentially needs to be treating.
There's a question from Northern New England Poison Center. The exact, so it'd be helpful to document the exact product. Consider taking a photo and adding it to the medical chart. Absolutely. We can do that with the HiQ app. Great suggestion.
Right. And they also put in here, remember that child resistance does not equal child proof. I try to be very clear that, child resistant packaging, they're definitely not child proof. But again, it's a good point.
So I think if there's no more questions, we'll wrap up, and thanks for great grand rounds.
Excellent. And if other questions come up, just email Chris or me. We're happy to talk further by email.
Thank you.